webinar about the Masters of Public Health at Macquarie. Before we begin, on behalf of this gathering, I'd just like to take this opportunity to acknowledge elders past, present and future. And thank you. My name is Luke and I'm a student ambassador for Macquarie University, here to help moderate tonight's webinar. And we are joined tonight by Professor Janaki Amin, who is Course Director of Masters of Public Health. So what we will be doing tonight is having a bit of a presentation from the professor, just to give you a bit of an idea about how the Masters program works. If you have any questions throughout the presentation, feel free to just put them in the chat box and then we'll try and get to them during a Q&A session afterwards. We won't likely get to all the questions, so members of the Future Students team will reach out to you afterwards. So please remember to mute your microphone during the presentation, and the session will be recorded. So if you want to watch it again, or if you might have not enough time to watch it all tonight, it will be available online. So tonight we have, as we've mentioned before, Professor Janaki Amin, who's the Course Director for the Masters of Public Health. She is also the head of the Department for Health Systems and Populations. So while she gives the presentation, feel free to put any questions in the chat below. I'll also open it up and you can also just talk and ask your questions without having to type it in if you feel comfortable. So without further ado, Janaki, take it away.
Thanks, Luke. And I'd like to also acknowledge the traditional owners of the people who have been here for centuries before us. And we come together on their land. Even in a virtual space, we're standing on that land. So thank you for showing your interest in the Masters of Public Health program. There's probably been no time in the recent past that has spoken to public health as a field of endeavour that we think is critical to the development of humanity at the moment. So I don't have very many slides for you today, but I'd just like to speak to you about what we do and how you can be involved in public health. So especially if you're joining us in Sydney, New South Wales, Australia today, from the beginning of this year, we've seen many challenges to public health between the bushfires, the COVID situation, and now the Black Lives Matter movement taking off yet again across America and in Australia as well. All challenges that are connected to public health and our ability to be healthy in the total sense of what health means. So not just being well, but being able to be free from sickness and to be healthy in all the dimensions of what that encompasses. So when we talk about public health, it is that broad array of disciplines that we talk about. And in a Masters of Public Health program, we want to cover the basis of the critical components of public health, which look at the determinants of public health, why situations arise that impact on positive and negative states of health, the policies that can promote health and can also detract from our health, the way that we count health events. So I'm an epidemiologist by trade, that is my speciality. And never before have I actually known so many people who understand what I do. Epidemiologists have come to the forefront of our news broadcasts in a way that hasn't happened before. So very much the understanding of epidemiology as a foundation of public health, and it was very much the foundations of historical public health, and how that's now grown into health promotion and health policy, health advocacy. All of these are components of public health that we will be teaching you about if you choose to do a Masters of Public Health with Macquarie University. So there's been a growing demand for health professionals in the country over the last 10 to 15 years. And that has been as a result of endemics of chronic diseases like obesity, diabetes, heart conditions, as well as the understanding of the prevention of illness and physical activity, good nutrition, and as those fields of endeavour have grown, as we understand what those concerns are, we need to be able to elicit desire among the population to embark in healthy behaviours, as well as create policies and programs to support people in creating healthy lifestyles, as well as holding governments to account in delivering healthy programs and advocating for healthy lifestyles for the population as well. So as you move through this program of education, you'll learn the skills to work in those fields. There's a diverse range of skills that you would need, and to be truly authentic in how we run this course, we have a real diversity of the types of assessments that you might do, or the types of learning environments that you will be in, that reflect what would be required of you in a work environment. We have strong interdisciplinary connections between areas of the university that are relevant to public health, so mental health, environmental health, global policy and legal and health economics, as well as a very keen and focused strategy of teaching within the department that is truly programmatic. So you'll see examples of public health interventions like looking at obesity or nutrition or smoking across a number of units, so that you can see how one public health event like cessation of smoking can be used as an example in epidemiology, in health advocacy, in health promotion, and in policy. So it's very much a programmatic approach to learning within the Masters of Public Health at Macquarie University. So how is our course set up? There are core units that you will be learning, which are Foundations in Public Health, Epidemiology and Statistics, Determinants of Health, Health Economics and Law, Health Promotion and Health Systems. So we feel that these are the fundamentals that any public health course should include. As I said, there's a programmatic approach to them. Those units are all integrated in how they teach, and you'll see common examples throughout them, as well as giving you the diversity of thinking about how a single problem can be attacked from a multitude of angles. Additionally, we have elective units in information technology, leadership and advocacy. We have new elective units in infectious diseases, inclusive health, which looks at the health of marginalised populations, program planning and evaluation in health promotion, global nutrition and food security. So those units are all run from within the department. And we also have interfaculty units on global health, leadership and environmental health. So there's a broad array of units that you can study through a Masters of Public Health at Macquarie University. And as I keep saying, public health is a really diverse range of specialities within it, from economics to health systems. And one of our key partners in delivering the Masters of Public Health at Macquarie University is the Australian Institute of Health Informatics, who are located at Macquarie University, and they teach into the health systems unit and the information technology unit. So they're very much practitioners who are teaching into the public health course as well. One of the other key areas that people ask us about and we're very proud of is our professional practice stream. So within the Masters of Public Health, in your second year of study, you can choose to do professional practice, which accounts for 4 units of study. So it's a full-time load for one session. So it's one of the most intense public health placement options in Australia that's available as a part of a Masters of Public Health program. So as part of that placement opportunity, you get to work in a public health delivery area, whether it's in the Cancer Council, the Heart Foundation, Macquarie Hospital, the public health networks. We have a wide range of opportunities of where students can go to placement. And as part of that, you're integrally involved in a project or in an array of projects. So we really have designed this opportunity so that you can give something to the workplace as well as gaining something from the workplace. And through that system and through that program of placement, we have had a number of students who've then gone on to get work with their placements, or they've used the skills in that work placement opportunity to get other jobs in public health. So it's been a really fruitful relationship. We've had every placement that we've had, the placements have come back to us and asked for more students. So it's a competitive process to get into the professional practice stream. It requires you to have performed well in your first year of study, and we also go through a system to put you into the right placement. So we give you a list of placement options that are available, and you nominate to us which ones you would like to go through, and then there's an interview process to be placed. If there is somewhere in particular that you'd like to engage with in terms of placement, we can also look at arranging a placement opportunity. So in conversation with you and your potential or desired workplace, we can arrange placements if that's possible, or we can definitely investigate the possibility. And the third option in the Masters of Public Health is to undertake a research year. Again, this is one of the most comprehensive opportunities for research in a Masters of Public Health program. It's a full year of research, so this is quite different to other Masters of Public Health programs where you might see that it's a half load for one session. This is a full load for a full year. So it's a selective entry process again, that you have to have performed well in your first year to be able to go into the research year. Once you've completed that research year, it makes you eligible for a PhD. It's not a guaranteed entry into a PhD pathway, but it provides eligibility to a PhD. So currently we have students who are supervised by my department, the Department of Health Systems of Populations, the Biomedical Sciences, the Macquarie Health Clinic, and the Red Cross. So there's a variety of places in which you can do your research and be supervised. It's an intensive year, and it's a really valued program that it gives you a taste for research to see if it's a pathway you want to follow, and if it is, then some opportunities to move into PhD, or just to learn a range of skills in research that would make you very eligible to work in research institutes in public health. So they're the main ways to move through your Masters of Health if you do an MPH at Macquarie University. So the three ways are the full coursework, doing some professional practice, or doing the research year. They're the main pathways that are taken through the Masters of Public Health at Macquarie University.